And well, during your work you have problems with pain and swelling and...
Yeah, when I'm on my feet.
Yeah.
When a new patient comes in my office, first I do of course the examination, look if the diagnosis is correct, which stage with therapy is already done, and then I decide if the patient is a good candidate for liposuction. There we have some criteria derived from my 20 years experience, and if I see she is a candidate for liposuction and will have a benefit after I explain, and then together with the patient I develop a plan of treatment. In many cases more than one procedure is necessary.
She has a lipedema stage 2 of the whole leg type. Again, the criteria for the diagnosis is first the disproportion. We have a disproportion of the shape of the legs and the upper body. It's best visible when the patient is normal weight. The second criteria is the pain. The pain she has, and when we don't touch, or pain when we press the subcutaneous fat. Then we have to check the stemma sign for the criteria of lipolymphedema. Can you put off the shoes, please? We have to look at the feet and check if the skin fault is possible to feel, and in her case we have no edema in the feet, and so the fat is soft. We have no dint here when I press here. That's the ideal, the best condition for liposuction. Okay, when I treat the whole leg, I start with the inner thigh and inner knee area, then the out, and then the lower leg. I just want to demonstrate the planning and marking. Here to here. Here, the incisions. 1, 2, 3, 4, 5. Okay, now I start with little injections to anesthetize the skin. No?
Okay.
Think about some mosquitoes. Patients say that this is the most painful part of the procedure. But you're very brave, so we will manage to do this perfect. Now I start the infiltration of the Tumescent solution. It's a saline solution with local anesthetic, very diluted. But for safety, we don't infiltrate more than 6 liters. Sometimes 7 in more heavy patients, but 6 liters is the limit. And we use these needles which are a little bit thicker. Okay, stop. But I anesthetize the skin in some spots and I try to hit them. Now I'm going to infiltrate the Tumescent solution. You will feel it, but there should be no pain. Yeah? Now the incisions is just 3 millimeters. Yeah? 1 here, here, and here. You will feel something, but there should be no pain. Yeah? Okay. If there's any pain, please tell me. Don't be scared. Yeah? Yeah. that's a perfect, completely normal result 1 day after surgery. Yeah? You see almost no hematoma in this case. There's a little bit bruising, but this is fine. Huh?
Yeah.
And what's important for the checkup next day, to look if there is a swelling, but she has none. Yeah, it's perfect. She wears the compression stockings, of course. And then we check the lower leg, that everything is soft and no pain. And here also. Okay. And then I check that all the tumescent fluid got out. And that's fine. Feel a little bit pale and blue lips and heat in your head, I think. That is a normal side effect of the local anesthetic.
Yeah.
But this will resolve completely after 1 or 2 days. Huh?
Okay.
Drink a lot, take vitamins, then it will support the healing process. She's normal weight and she has a lipedema of the whole leg type. And we planned 3 sessions of liposuction. We did the first session last week, it's 1 week ago, the inner thigh and inner side of the knee. And we see here a normal situation with some hematomas, but they will heal. And again here the check for just a little bit edema. Here is soft, it's perfect. Yeah? And also I check here to make sure that all the fluid is going out. Yeah? But it's fine, it's soft. There's just little pain, but it's okay. Yeah? Yeah. Okay, that's the completely normal situation 1 week after liposuction. She also will continue compression and manual lymphatic drainage. Huh? And we plan the next session when we have the appointment?
4 weeks.
In 4 weeks,
Yeah,
yes.
exactly 4 weeks.
In 4 weeks we do the out and last the lower legs. There is a time between the onset of the disease and the diagnosis and then start of the sufficient therapy. That should be in the future shorter, because now we know the progress can be stopped when we treat early. And the time to the correct diagnosis and correct therapy is lost lifetime. And that one I want to avoid for the patient.